Dr. Deb Legge back again for part 3 of the free video series Getting Paid. As I promised in the last video, this time I'm going to talk to you about talking to your clients about money. As I said last time, the attitudes that you have about money are going to come through in the way you describe money situations with your clients and with your referral sources. Money is a therapeutic issue, not only for clients, but for us as therapists as well. If you've got a problem with money, if you think that you don't deserve it, if you think that you don't feel comfortable charging people a lot for sessions, if you feel uncomfortable around issues of money, I urge you to sort those things through either on your own or with the help of somebody else so that you can really take charge of this part of your business. As much as your business is about doing therapy and helping others, a huge part of our business as clinicians, as private practitioners, is all about money. So the more comfortable you are in this area, the more effective you're going to be in bringing clients into your practice, and the more effective you're going to be in collecting your money from your clients. So in this video, I wanted to talk to you just a little bit about how you do talk to your clients and your referral sources about money. When my coaching clients come to me, one of the things that they're concerned about with regard to money is how am I going to talk to my referral sources? I'm brand new. I don't take insurance yet. I'm trying to get on panel, but I'm not there yet. How am I going to let these people know that they're going to send their patients to me and I'm not going to be able to provide that type of insurance coverage for them? Well, the fact of the matter is, and we talked a lot actually about the pros and cons of taking insurance and how about confidentiality and all those other things, but sometimes those don't come into play or it's not something that your referral sources are going to give you time to talk about when you're promoting yourself to them. However, I think it's important that you get the point across. So even if you have to make up a little brochure that talks about the benefits of a private pay situation when it comes to mental health, play up the confidentiality piece. Just even a one-sheet fact sheet that you can hand to the physician and to let them know, at this time I'm not accepting insurances, and these are some of the reasons why. Or to be able to tell physicians, at this time I don't take all insurances. However, I will talk to your clients about what insurance they have, what insurance they want to use, and if I can see them, great, and if I can't, I will give them a couple of good referrals into the community. At least then you're putting your referral source at ease in that their patients or their students or their parishioners or whomever they're sending to you are going to be well taken care of, even if it's not directly with you. All right. Now when it comes to clients, when they call you and they say, I saw your website, or I heard about you through so-and-so and I want to make an appointment to see you, I just want to make sure you take my insurance. Well, if the answer is no, I don't take your insurance, you let people know that, I'm not on panel with that insurance company. However, I do have a private fee that I charge when I don't take your insurance, and I can talk to you about that, and we can also talk about whether or not your insurance has an out-of-network benefit. At that point, the client is kind of taken aback at first because you don't take their insurance, and they may start to close their ears. But that's why you have to follow up immediately with the solution of, I'm going to talk to you about my private fee, which I have for people whose insurance I don't take, and I'm going to talk to you about whether or not your insurance company might have an out-of-network benefit that we might be able to work with. Okay? So it's like a 1-2 kind of punch, and it's important that you give them that first jab, and then you got to pull them in with the second one. You're going to talk to your clients about, first of all, the fact that, either, whichever's true for you, either you have 100% private pay, private practice, and these are some of the reasons that you do that. And then you talk to them about the confidentiality, and you talk to them about not having to ask insurance companies for sessions, not having their health care managed by insurance company, having decisions about their mental health stay between the two of you, and how important that is to you as a professional. That one of the reasons you came into private practice was to be able to get away from insurance companies so you could provide the best treatment possible with the fewest restrictions. those types of things you should be able to talk about comfortably and confidently, just like I'm presenting them to you with your client when you're trying to explain to them why you have a 100% private pay, private practice. For some of you who take some insurances but aren't on panel with all the insurances, I know I'm in that situation. I take some insurance, but there are others that don't allow licensed mental health counselors in the state of New York on panel yet. And I just simply explain that to my client. I do take some insurance. However, your insurance company is not one on which I'm, with which I participate. And that's because they don't put licensed mental health counselors on panel yet. They're a little bit behind. And, I can provide you with all the information you need if that's something you'd like to discuss with your insurance company, perhaps to get a waiver so that I can see you under your plan. Otherwise, I can take your information and I can call your insurance company and find out whether or not you have an out-of-network benefit. And then I'm happy to tell you how that plays out in our relationship, in my practice. You see, the important thing is to maintain that eye contact with them when you're talking to them about money issues, and not be apologetic, to be very matter of fact. Whether you don't take insurance, whether you're not on panel yet, whether you have to have 3 years of experience before you can get on panel, you decide how much you want to share with your client. And then whatever it is you're going to share with them, you keep practicing in front of the mirror until you can really feel comfortable with it. Now, if the fact is that you are 100% private pay, private practice, because of and by virtue of your credentials and how that plays out with insurance companies in your area, and you'd really like to be on insurance companies, and you feel really bad that you're not on insurance companies, and you feel kind of less than because you're not acknowledged by the insurance companies like other professionals, that's going to come through to your clients. If you're kind of hanging your head or, talking down the insurance companies because they're not taking us yet, or, this, that, or the other thing, that's not an issue that your client has to be involved in. They just need to know how much it is, what your payment options are, and how you're going to proceed. Okay? Especially if you're not taking insurance, it's important, I believe, for you to be able to take credit cards. It'll be important for you to take debit cards and credit cards. The other issue is that many clients with their insurance now get those flex benefit cards that they're able to use for certain medical expenditures, and they're able to use them in your office for your private pay fees. And it's kind of a backdoor way of them paying you by using their benefit card. Okay? So it would be really important for you to be able to take credit cards to do that, because those cards almost always have either a MasterCard or a Visa logo on them, and so you can put them through. When you are signing up for MasterCard and Visa, whether you do it through your bank or whether you do it through an online source or you do it through one of the many merchant accounts, when you go to Google it, you can just Google merchant accounts, and that's where you'll be able to talk to, get the information so that you can talk to several people about what they have to offer. You need to let them know that you are a medical entity, and so when they program your machine, they'll be able to put a chip in it or some kind of a code in it so that those flex spending cards can go through. That's very important. For example, a person can't take a flex spending card and go to Walmart and buy a blow-up swimming pool for their kid and put it through on that. It's not going to work. But when they come to you because you are providing medical benefits, mental health, professional benefits, they should be allowed to be put through. When it does come to the credit cards, it's very nice to be able to take them because, for example, let's say you're running a group and that's a 4-week group and you're going to charge a full amount for the 4 weeks. It's much easier for somebody to put that on their credit card and pay that off over time. They're much more apt to put $200 or $300 on their credit card than they are to be able to write a check for that or to hand you the cash. It's just kind of, think about you. I know for me, I'm not as conscientious about handing over my credit card as I am about digging into my purse for cash. So think about making it easiest for your clients. When it does come to credit cards and credit card companies, be aware that there are fees involved. So let's say somebody charges $100 with you, and you're not going to get that $100 back from the insurance or from the credit card company. They're going to keep their piece. They're going to keep fees for this, that, and the other thing. There may be a fee for your machine every year. There may be a fee for the service. Different cards, especially if you're getting into like the American Express and the Discover card, bring much higher fees. So be aware of what those fees are so you can determine which cards you're going to take and which cards you're not going to take. And also so you know how much it's affecting your bottom line so that you can set your fees accordingly. That's very important. You may be renting space in an office situation where the person who owns the office has the credit card services, and you are able to use their machine, and they keep a percentage, like a 5% or something like that, for the fees and for their time. And then you just don't have to think about it at all. And then out of $100, you know you're going to get $95 and you can go on with your day. You can also decide to do your billing through PayPal. PayPal has billing options now that you can use where you can email the invoice to the client in advance, and they can pay in advance before they come in. They can pay that with their credit card. There are also other options with PayPal and other payment sources online. So just do your homework and decide to do that. But when it comes to talking about money, let's get back to talking about money with your clients. Again, the absolute most important thing that you have to do is to be comfortable. You have to be comfortable with your own opinion of money and yourself, what you deserve, what you believe you are worth. And then when you talk to your clients about that, you are able to let them know with confidence how much your fees are. You know, I know some folks, I've had some coaching clients who came to me because they weren't making any money. And the reason they weren't making any money is because they were charging less per session than that same client would spend after they leave and go to Applebee's for lunch. That doesn't make any sense. You went to school a really long time to get where you are. My guess is that you either spent a whole lot of money, worked really hard for a scholarship, or you've got a big fat school loan that you're paying off. And because of that, you were trained as a professional. You deserve to be paid what you're worth, and you should not feel guilty about that. Okay? Again, if you get into a situation where you're feeling resentful about how much you're charging your clients, that's an issue that is all yours. You need to work that through in the mirror or work that through with somebody in supervision so that you can collect what you need to collect. We all do our share of pro bono work. Okay, and there are going to be some clients that you're going to provide a reduced fee on a temporary basis for certain situations. You know, that's probably going to happen. But for the most part, you should essentially feel very comfortable about what you're billing. When we talked about setting fees last time, I talked about setting your posted fees. I would just encourage you to update those fees every year and increase them, because some insurance companies will reimburse the full fee, and you don't want to leave any money on the table. Okay, so I think that's about it. You know, in just giving you some things to think about in these brief little videos. So the key is you be confident, you be certain, you be clear, eye-to-eye contact, letting people know, and not feeling apologetic or making excuses. Feeling comfortable going into a referral source by saying, at this time I do not participate with insurance. However, these are my niche services. These are the things I can offer your clients. And I will work with them to come up with a fee that works for both of us. And if that can't happen, I will be happy to provide a couple of good referral options for that patient, and I will let you know. Okay, it might take you few minutes extra per month to triage those clients out into the community, but if you can get that referral source to know that, hey, I can send that client over to Deb, and I know that Deb's going to work her hardest to provide services, and if they can't come up with a fee, I know Deb's going to give them a really good referral, and she's going to let me know about it. That's all they really want to know. Okay, the doctors don't want to, and the psychiatrists and the clergy and everybody else, they don't want to micromanage manage the money aspects of your practice. They've got enough to do in managing their own. All they really want to know when they send clients to you is that you're going to take care of them one way or the other. Okay? So stop getting so hung up about money. Start feeling good about how you're talking about it. Be careful about your language when it comes to money, not only in your private practice, but in your life. Think about it when you say things like, I can't afford it. I don't have enough for that. There's never enough money to go around. That really scarcity type thinking is dangerous for you. Be careful with your language. You'll feel more confident, and you'll be able to project the message you want to project to your referral sources and to your clients. Okay? You take really good care. I hope this is helpful to you. And in the next video, in the final video, we're going to talk about the credentialing process with insurance panels. Okay? And I'll talk to you then.